Now we'll go live with Congressman Cole, who will share some important updates about the ongoing response to COVID-19. Then we'll open up the line to some of your questions as well. Congressman?
Thank you very much, Sarah, and thank all of you on the call for taking the time to listen in. This is our third teletown hall meeting in 3 weeks. We usually prefer the live version where we're actually in your community, but obviously given the restrictions we have about groups right now, that's just simply not possible, and we thought this was a good thing to do. We've done them before, but we've really beefed them up given the situation we're dealing with. Last week, when I did a teletown hall, actually last Thursday, we were on the eve, it turned out, of passing what's called the third supplemental bill that actually deals with coronavirus. The first two were first an $8 billion bill to put additional resources to the Center for Disease Control and the National Institute of Health to develop diagnostics, therapeutics, and ultimately a vaccine. Obviously, we needed to do that, and to provide some additional resources to try and bring Americans stranded overseas home. The second bill, which came literally a couple weeks later, was a much more robust bill, about $104 billion. It was designed to give every worker in America the option of taking sick leave if they thought they had COVID virus, whether you're, COVID-19 or coronavirus, whether you had sick leave or not. Clearly, we wanted you to not feel the need to come into work if you were sick, but we also wanted to compensate small businesses that maybe don't have that level of benefit, and we did that. We also beefed up a range of programs that were clearly going to be needed in this kind of crisis. Nutrition programs for single parent households, additional money for things like Meals on Wheels, stuff like that, additional support for state unemployment funds. And then last Friday, the United States Congress passed probably the most sweeping bill in the history of the United States. It's the largest single spending bill ever passed, over $2.3 trillion. The most complex piece of legislation probably ever passed because it meant to deal with this crisis on many different fronts. And then obviously it's going to be extraordinary to try and implement because, again, the government's doing a lot of things that it's never done before. That bill just broken into several parts. First dealt, as you would expect, with health care priorities. That is additional money for masks, for ventilators, for other supplies, things that people on the front line need and, are in critical supply because every country in the world is trying to get their hands on these kinds of items right now. And then second, we put in $100 billion to help hospitals that are really, again, the front line of fighting the disease. A lot of hospitals not only are under extra strain, they're foregoing revenue that they normally would receive so they can devote resources and time to patients with coronavirus. And some of that money, by the way, will compensate. We're working on the details of this now. Everybody should be able to go get treatment and not be charged. If you've got insurance, obviously the insurance will be called upon to do its part. But if you don't, and you need to be hospitalized, the government's trying to make sure that there are ways that that can be paid for without bankrupting you or your family. So very robust health care package. Second element was direct help to individuals. $1,200 one-time payment to every adult, just about every adult, $500 per child. So in a family of two, a two-person household, it'd be $2,400. If there happen to be two children there as well, there'd be an additional $1,000. That money should begin to arrive about April 9th. If you normally pay taxes or you turn in a tax return, then it's pretty easy. They'll get the money to you. If you're on Social Security, it will take a little longer, although not much longer, and that money will be coming to you. So again, it's an extraordinary effort. We've never done anything on this scale before, but people will begin to see the checks, literally tens of millions of people, beginning on April 9th, which is actually a week earlier than they originally committed to. But they are trying to move the money out of the Treasury as rapidly as they can. A third component of the bill, in addition to help to individuals, is help to state, local, and tribal governments, about $150 billion altogether. We know states are undertaking extraordinary expenses. We also know that they're having a tremendous hit to their revenue stream. Certainly that's true with local governments and tribal governments as well. So this is to help them with some of the expenses that are directly related to the actions they're having to take to deal with coronavirus. Fourth element is help to small businesses. Obviously, some of the public health measures taken here literally are forcing restaurants and cafeterias and recreational things and many businesses to close down. We want those businesses to be able to retain their workforces. So $350 billion was set aside. More is necessary. Frankly, I think it will be forthcoming, so that if a business owner will keep his people in place, we'll loan him the money to pay them, and then as long as it's been used for that loan will be forgiven. In other words, it's effectively a grant to small businesses to keep their employees. If they've already let them go because they weren't certain the legislation would be passed, that's fine. If they rehire them, they're certainly eligible for the loans, and they can go ahead and put their people back to work. Another element, fifth element here is literally billions of additional dollars to unemployment funds. If you've followed the news, you noticed the last 2 weeks we've had record filing for unemployment checks, 3.2 million Americans last week, over 6.6, I believe, literally announced today. So that's 10 million people out of work in 2 weeks. Now, every one of those people is immediately eligible for an unemployment check. We've waived the normal delay because, again, they're unemployed through no fault of their own. In addition to that, Congress has authorized an additional $600 per person per week for the next 4 months. So your unemployment check will be a lot more generous than it's been in the past, and our hope is that will help people get through this and then on the other side of it be able to get back to work. Next, there's also $500 billion set aside for the Treasury to make direct loans. These will be paid back to things like major employers, particularly the airlines and Boeing. There's a lot of other money, by the way, available in what's called the paper market. The Fed has interjected literally trillions of dollars into that, so commercial paper can be purchased for companies that, again, are under enormous strain. So these are really sweeping measures, and just to review all three of those bills that have passed, and there's been a lot of other actions taken by the federal government as well, have passed overwhelmingly in a bipartisan fashion. That is, I think there were only 2 no votes on the first bill in the House out of 435 members. There were only 1 Senate no vote. The next one passed the Senate like 90-8, and the House with 30 or 40 dissenting votes, and I think they dissented because the legislation was produced and got to the floor late at night, literally after midnight, the day it was dealt with, and many members had not had the opportunity to read the bill or weren't familiar with it, so they appropriately stepped back and said, no, I want to know more. But we were in crisis mode, and we moved ahead. And then the bill last Friday had passed the United States Senate, I believe 96-0, and then passed the House of Representatives on a voice vote. It was very overwhelmingly obvious that there was very little dissent to that bill. So despite all the normal politics and partisan divisions, and particularly coming right after impeachment, the government has actually moved with extraordinary speed and bipartisanship in trying to meet what's really an unprecedented crisis for the country. Last point before we open it to questions, do remember, and I think we actually will have very shortly a timeline posted on our website, but all of this began literally 12 weeks ago. Everything that's happened on this has happened at light speed, both in terms of literally on December 31st of last year, nobody in America knew anything about coronavirus, and we weren't officially informed. We began to learn something literally that evening about that China clearly had a problem it couldn't handle, and it was going to break beyond its borders. And then the World Health Organization began to tell us a little more, and the Chinese a little more. Frankly, both of them, in my opinion, were late to the party, so to speak. If they had made information available, particularly the Chinese government, earlier, we'd all be in a much better shape. But everything that's happened since then, travel bans, declarations of first a national health emergency, then a national emergency, then the restriction of travel to and from China, restriction of travel to and from Europe. Again, none of these things, by the way, have ever happened before in American history. We've never exercised that amount of restraint on travel to other countries, or that amount of both either not letting you in or requiring you to be quarantined and certainly tested before you're released into the country. So that probably bought us some extra time. But you can see that's all it did. It bought us time. It's not possible in a global pandemic to think you're going to be able to remain isolated. So we're continuing to move in real time. I think Congress will probably pause after this legislation for at least a while to see what works and what needs to be fixed. We want to make sure that people do get their checks, that businesses do get their loans, that in smaller companies, that is companies below 500, those loans can be forgiven, and that the terms for larger corporations are very, very generous. But I suspect at some point we'll be back legislating again on this as we get a better feel for what we need, or we find that some of these programs need additional funds. I think, again, there'll be strong bipartisan support to continue to make sure that the American people and businesses get what they need through this, and certainly that our hospitals and our frontline healthcare workers get the equipment and support that they require as well. So that's what we're focused on, and we'll continue to be focused on, I'm sure, in the weeks ahead. And with that, Sarah, why don't we open it up for questions?
Sure. And just a reminder that if you're joining the call a little bit later, if you would like to ask a question, just press 0, and you'll be able to record your question and then return to listen. And be listening for your name and location in case your question comes up. But if you'd like to ask a question, press 0. Our first question comes from John, has a question about supplies, medical supplies.
Hey, John. Hi, John. This is Tom Cole.
Hey, Tom. This is John. My question is, I was on a call with the chamber today, the state chamber. Mm-hmm. The discussion came about how can we as Oklahoma businessmen get prepared for maybe taking advantage of the issue with China producing some of the stuff that we really and truly need to be producing here in the state.
I would be thinking ahead about, if you're in this business, both in terms of pharmaceutical supplies and in terms of medical, equipment and protective, with the so-called PPE, personal protective equipment, that sort of thing. Simply because it's clear, a lot of our supply chain is overseas, and 51 different countries, by the way, that produce different things. And by the way, we're doing the same thing ourselves, have restrained exports to one degree or another. So I think there's going to be a crash effort on the other side of this to make sure that this never happens to us again. That is, that our supply chain is inside the United States for really critical elements. We do that sort of thing now for defense. I mean, we don't build our ships, for instance, in the cheapest place to build them. You could probably build them in South Korea or someplace. We build them in the United States, and that's true with, most of our weapon systems are developed here. I think certainly with pharmaceuticals, we're going to start looking at this very differently than we have in the past, we'll guarantee markets and guarantee purchases of American-made products. And if that costs us a little bit more money, just as it does in defense, I think Congress will find a way to do that. So, again, if you're in those areas, I would start thinking ahead because, number one, we're going to have to restock the strategic stockpile. We're using a lot more equipment than we can buy right now. So there's going to be a guaranteed market there. But I think going forward, again, there's going to be guarantees that in critical elements in pharmaceuticals, there's already, by the way, legislation that does some of these things that make sure that, we buy all of our, pharmaceuticals for the military, or for instance, or that Medicare or Medicaid pay for from American suppliers. So I think you're going to see, a thoughtful but pretty rapid effort to make sure that we're okay and never have to worry about supplies coming from overseas again.
All right, we'll go ahead and move on to our next question. And again, if you would like to ask a question, press 0 so you can record your question and then return to listen. Our next question, we already had our first question, is Chris from Oklahoma City.
Hi, Chris. This is Tom Cole. How are you?
Hi, Congressman. I'm doing well. Hi, I just had a quick question. I'm a college student out here in California for the time being. I'm with family. And I had a question. When do you see restrictions being lifted or less severe? And when do you possibly think that we will start to get back to normal live routines?
Well, let me first add the caveat that I'm not a healthcare professional, and I think their opinions will drive this. I mean, as we know, this has been extended to the end of the month, so we're through April at least. I think they'll basically make a conditions-based assessment, running into that. I would not be surprised to see it extended another couple of weeks, depending on what the numbers look like then. I don't think it's likely to be extended past the end of May, so I think we'll be back in no later than June, perhaps a little bit earlier. But again, let me add the caveat, Chris. That's just my layman's opinion based on what I'm hearing. I'm quite sure that it'll be what the healthcare professionals advised the president. That's what he did when he made the decision to extend, this what was originally a 15-day period to an additional 30 days. And I think the numbers drive the decision. So the more people listen to what their state and federal and local authorities are telling them, follow those guidelines of sheltering in place, of social distancing, the quicker we'll get on top of things, the more likely things are to return to normal. Let me add this, though. We're still going to have to watch this for a while. This is now in the population, so there's every reason to believe it could revisit us. It might revisit us before we develop a vaccine. That's underway right now, as you know. There's over 40 different efforts to find the right kind of vaccine, and many, many more efforts underway to find the right kind of therapeutics right now. So, but we're just going to have to deal with this for a while, particularly until we get a vaccine. And so you're just wise to follow the instructions and the requests that you're given, and that'll get us through quicker, and we'll be back to normal faster.
Okay, we'll move on to our next question. But again, if you would like to ask a question, press 0, and then you can record that question and then return to listen. And be sure to listen for your name in case your question comes up. Our next question comes from Bree from Moore.
Hey, Bree, this is Tom Cole. How are you?
Good. How are you?
Good,
my question is, for those of us that are self-employed but we don't have employers, I'm a bail bondsman and a bounty hunter, private investigator, and officer of the court for serving papers only. Is there any help for us other than the individual check, for the $1,200 and
yes,
for the children?
Yes, there is. You are in this period. You're eligible for unemployment. So you're eligible for the weekly unemployment check in ways that you have not been before. So if you're a self-employed person, you're part of the gig economy, you should contact the unemployment bureau, and you should be eligible.
All right, I'll move on to our next question. Marilyn from Cash.
Hey, Marilyn, how are you?
I'm good. Thank you for this town hall meeting. I had a couple of real quick questions. Number
Sure.
one, for the unemployment, you said it was $600 per person per week for how many months?
4, and it's actually 600 on top of what normal unemployment would be. So that's in addition. So the payments, I don't know exactly what Oklahoma's unemployment rate is. Most states is $400 to $500 a week. So this would be 600 on top of that for 4 months.
Okay, and then secondly, Oklahoma has 7 different facilities for veterans. Can you tell me anything that's being done to try to help in that situation? I know they were kind of low on employees before to help.
Well, I can tell you that, extra money has been made available to the Veterans Administration to try and, make sure that they have everything they need to protect those folks in veterans facilities. We have 4 of them in this district. Actually, 4 of the 7 in Oklahoma are in the 4th district, and those are very vulnerable populations. Obviously, they're all in the age group and that make them, the most endangered, and quite a few of them have underlying conditions as well, which really complicates things. And we're pretty fortunate. We have a very dedicated staff. I actually visit these facilities on a pretty regular basis, and I'm always impressed with the quality of care there. But there will be extra money, extra resources to try and give them everything they need, and probably certainly extra attention too. There's a real focus on not only veterans facilities, but frankly, nursing homes. I mean, these are areas where we've had some of the biggest tragedies so far. So I know the state government, which actually does the inspections, has really ramped those up. And again, we're trying to make sure that the extra resources are directed in those areas to protect that particularly vulnerable population.
All right, we'll move on to our next question, but before I bring our next question live, just wanted to remind you that if you would like to ask a question, press 0, and then you can record your question and then return to listen to the call. Again, to ask a question, press 0, and also, if you'd like to opt into future telephone town hall discussions like this, press 1. Our next question comes from Lorene from Oklahoma City.
Hi, Lorene. How are you?
I'm fine. How are you?
Good, thank you.
Okay, my next question was is there going to be money for the senior citizens as well as the other families and things?
Yes, there is. They're eligible for that $1,200 that we were talking about per adult, and so there certainly is. So you don't have to be in the workforce to be eligible for that money. It's easier if you had been paying taxes, because then they've got a way to just directly send you and direct deposit the check. But you're still eligible. You don't have to file a tax return. They'll be looking at Social Security recipients, for instance, to get them the money. And again, it'll take a little bit longer, but not a lot longer. So, but they're certainly still eligible.
Okay, our next...
Just let me add to that, sir. I'm sorry.
Sorry.
Just so people know, this is for people that make up to $75,000 a year. Then it comes down a little bit for everything you make over that. Now that's per individual. It's $150,000 per couple, and that covers well more than 80% of the population of the country should be eligible for direct payment.
Great. Just a reminder that if you would like to ask a question, you can press 0 to record that question and then return to listen. And also, if you'd like to opt in to future calls like this, press 1. Our next question comes from Richard from Newalla.
Hi, Richard. How are you?
Hi. I'd like to ask a question about the chloroquine ZPAC protocols. Will Medicare cover any of that if you do become infected?
You know, I do not know. We're going to have to find that out for you. I'm not sure what they will or won't cover. I think one of the challenges here is there's a lot of anecdotal evidence on some of these medicines, but very little in the way of, given the time frame, clinical trials to prove what's effective and what's not. So again, I'm not certain, but if you'll call in to our office or leave that question where we can identify you, we'll try and get an answer for you.
All right. Our next question comes from Susan from Moore.
Hey, Susan, how are you?
Good.
Susan,
hello?
are you there?
Hello.
Hi.
Yes.
I am here. I was wondering if you have like rental property duplexes, but it's not that many of them, and it's not a huge business. There's no real employees, but the renters are going to be affected by losing their jobs, but then the owner would still have to make their payments. So,
Sure.
Is there any any help in that area, because people may not be able to pay their rent?
They may not, and I don't know that there's anything specific in terms of that. Again, one of the reasons why we've beefed up the unemployment so dramatically, is to try and make sure that they can. I mean, for most people, if you were getting $400 a week unemployment, additional $600 a week literally means you'd be making $4,000 a month. So hopefully that would put you in a position, at least in the short term, to pay that. Beyond that, if you don't have any employees, I'm not sure in this batch if there is anything. That most of those small business loans are meant to try and help people keep their workforce intact. But your best bet would be to call the Small Business Administration and ask them. Now, please understand that there's probably a long wait getting into those folks right now, because they're going to be dealing with a volume of things like they've never dealt with before. But beyond that, I'm sorry, I can't tell you much more.
Okay. Our next question comes from Kimberly from Foster.
Hi, Kimberly. How are you?
I'm good. How are you, sir?
Good, thank you.
I asked two questions, but you answered the first one with Chris on about how long did you think this would take before we got it under control, and I know that's all a guess and everything. But my other question was really not about Corona. Stated that I'm a teacher and that my husband was in the oil field, but he's semi-retired now.
Mm-hmm.
And do you think that maybe when the coronavirus is like slowed down or something, or do you think it'll be after the first of the year, maybe before oil field picks up?
Well, I hope it's sooner rather than later. I don't know if you happened to catch the news today. The president did have direct discussions with Saudi Arabia, and evidently they're pretty close to having a deal where the Saudis and the Russians will cut production. There's an emergency OPEC meeting coming up, and oil recovered about $4 or $5 a barrel. That helps, but it's certainly not enough. You can't sustain oil field companies on $24 a barrel oil. I do think this is going to get a lot of attention going forward because, again, the coronavirus slows down the entire economy, and, of course, that hurts energy. But the real root of this problem is a price war between Saudi Arabia and Russia. So that's going to take diplomatic action. We don't get to control those countries, but we have a lot of influence. We certainly do over the Saudis, who we've been more than generous to, and we literally have American forces there protecting them right now. So there's a lot of us that feel pretty strongly. I've been in a number of discussions with the president or amongst members of Congress on both sides of the aisle that feel we ought to be using more in the way of leverage in dealing with both those countries. The best thing we have going is long-term, this isn't very good for them either. And that is they're busy destroying their own economies, and every time you do something like this, you never recover quite the market share that you had. So all I can tell you is we'll keep pushing. I think it'll take a while, though. It's going to take certainly a full economic recovery where we get demand up to where it's traditionally been, and then on top of that, we're going to have to have a little more common sense than either the Russians or the Saudis have shown, because while they're hurting themselves, they're hurting the energy industry all over the world, and that's not just the United States. We have friends. We import considerable crude still from obviously Canada and Mexico. We don't import very much from the Middle East anymore, thank goodness. But those countries, also have robust energy economies like we do, or energy production, and they're hurting. So anyway, hopefully we can talk our way through this and get to a more stable situation. But it's a rough time right now in the energy patch in Oklahoma, no doubt about it.
All right. We'll go ahead and move on to our next question, and this one comes from George from Midwest City.
Hey, George, it's Tom. How are you?
I'm doing fine, thank you, sir. And thank you for having these phone calls where we can talk to you.
Well, I'm delighted you took time to participate.
Okay, my question is, it's on the unanimous consent. Why hasn't, in this day and age, with this crisis going on now, and you all don't need to be together up there in Washington, D.C., if you need to use electronic vote, if it takes a bill to pass, say, hey, we're going to stay home and we'll vote from the House, why don't you all do it?
There's all kinds of constitutional, parliamentary, and logistical questions in that. You'd have to establish the system, and this has been discussed, but it's never been implemented, and to do it in the middle of a crisis is pretty tough. Now, we still, again, this isn't as unbelievable as all this is. It's not unprecedented. The United States Congress was hit just as hard in 1918 and 19 by the Spanish influenza, and they managed to operate for a year basically on unanimous consent and then rarely coming back. So we still have unanimous consent. We can move things. If you don't do that, and we had one member that did not want to operate that way, enough members came back. In full disclosure, I was actually in quarantine because I'd been exposed to another member with coronavirus a few weeks earlier, well, less than 2 weeks earlier, actually. And so I wasn't able to make it back, but we got about 270 odd members back. That's a majority, and they can operate by voice vote, and they did. So we are looking at that. I actually sit on the Rules Committee, but it's honestly something that there's quite a bit of controversy about. A lot of members don't want to do it. A lot of legislating is not just voting on the bill. It's actually being in committee. It's actually working with the other side and finding a compromise. Now, we did pretty well on this last bill, and I think we're getting better. But, again, you would have to change the entire rules of the House. And to do that, by the way, you have to show up in person to vote to change the rules. So I think there will be more thought given to this going forward, but I don't think it's likely to happen in the course of this particular crisis. That is, I think people feel like they've got other tools that they can use right now.
All right. We'll go ahead and go to our next question. But if you'd like to ask a question, press 0. And if you'd like to opt into future telephone town halls like this, press 1. Our next question comes from Belinda from Hastings.
Hi, Belinda. How are you?
I'm doing well, Congressman. Thank you so much for having these times that we can talk to you and voice our concerns. My concern, Congressman, is, of course, Hastings is a very small little rural community. Mm-hmm. I am wondering how well our rural communities, hospitals are prepared as far as testing, life-saving equipment, and medication for treatment.
No question they're more challenged than some of the urban hospitals for several reasons. One, they tend to take care of an older population. They also, frankly, get less private insurance. There's less of that in rural Oklahoma than there is in the metropolitan areas, so they operate on very thin margins. And you've seen a number of our rural hospitals have closed in the last few years. And they also, if you're operating on thin margin, it makes it tough to get all the equipment that you would like to get that's cutting edge. Having said that, again, there's going to be $100 billion put out there to help hospitals. We're going to compensate people that pay take care of coronavirus cases at literally a higher rate than Medicare or Medicaid would normally compensate for other kinds of folks. And then on the testing sorts of things, actually, we've had a problem. We're catching up pretty rapidly. I will tell you, Oklahoma probably hasn't gotten as many of the tests as places like New York and California, and that's largely because the number of cases there is just higher. It's not anybody discriminating against us, but I did notice that the state got about 60% of what it requested with an assurance that more was on the way. So I think we're making up time. I will also tell you that I was on the phone last week and again this week with the University of Oklahoma Health Science Center and also Oklahoma Medical Research. So they're cooperating to actually improve our capacity inside of the state to actually do a lot more tests. So you'll get them back a lot quicker than has been the case. So we're making progress, and some of our own institutions here are really in the forefront of that. But we still got a way to go to get everybody where we would want them to be, and the challenge is always tougher in rural areas.
Okay, our next question comes from Sylvia from Midwest City.
Hey, how are you?
Sylvia, are you there?
I'm fine, thank you.
Oh, great.
Did you hear my question?
No, we did not hear the question, Sylvia. Could you repeat that for us?
Yes, I was wondering on this money that the people are going to receive, if that's going to be taxable.
I don't. That's a great question. It usually is if it's income, but I think in many cases, it's going to be people. In many cases, aren't going to have to pay it because they, in many cases, don't earn enough to pay it. But most income is taxable.
Sir, I do actually. I had gotten a question about that matter recently, and it works like a tax rebate, so it's not taxable.
Okay, good. Good news. Thank you, Sarah.
I happened to answer that question myself recently.
Well,
sure.
I'm glad you straightened me out on it. Good.
No problem. Let's see. Our next question comes from. Let's see who we're going to go to next. Sharon from Waurika.
Hey, Sharon, how are you?
I'm doing fine, thank you. I'm kind of curious because the president keeps saying that it's the individual governor.
Hello?
Oh, no, I think we lost her. So sorry. I don't know what happened. We'll have to...
Well, let me take a guess. Sharon, if you said the individual governor that decides whether or not shelter in place, that sounded like you were headed where you were headed with the question. Actually, that's true. Now, the president can make strong recommendations, but the power to quarantine and restrict movement it's largely a state power. It's not a federal power. Now, mostly the states do what presidents ask them to do, but they don't have the power to order it. In other words, the president couldn't issue an order and impose a shelter-in-place order for everybody in the country. If there was a governor out there who didn't want to do it in the state, he doesn't have to.
Okay, we'll go ahead and move on to our next question. We have Lodi from Oklahoma City.
Hey, how are you?
I'm doing good, Congressman. My question deals with support for the oil companies because in regards to the state government, because Oklahoma is pretty well set up to where they rely on a lot of taxation of oil and gas, and they're going to have a huge shortfall due to this coronavirus. So is there something that's going to be done for outright grants to state governments so that, if they have shortfalls, they generally cut people, and you may not get those people back?
Yeah, no, that's a good point. There is direct money in this bill for state governments, and now it's to be used largely for coronavirus-related expenses. But the reality is they're going to be awfully generous with state governments. We all recognize that income because of coronavirus has been cut. And obviously, that's a double whammy in Oklahoma because of the energy problems, oil and gas problems. So we are working on that separately. The president, again, working to try and cajole, honestly, the Saudis and the Russians into being a little more reasonable with one another, and it appears to have had some success today. But that's going to be an ongoing problem. I would not be surprised once we get a better handle on things if we come back and look again at the revenue streams for various states. So all I can tell you is there is considerable help in the bill that we just passed for the state of Oklahoma and every other state in the country, and we'll continue to try and look at that problem going forward.
All right, we'll go ahead and move on to our next question. But just a reminder that if you would like to participate in future calls like this, just press 1. Our next question comes from Steve from Maysville.
Hey, Steve, how are you?
I'm good, Tom. Thank you for taking my question.
Sure.
My question pertains to businesses that are being shut down, and just wondering who made it. Who makes the decision of what's an essential business and what's not? Is that done locally, federally, or
yeah,
state?
Basically it is. You'll see variations between governors. Now, again, to be fair to them, they're following guidelines, and but at the end of the day, that's largely a local decision, or excuse me, a state decision, not local. That's not fair.
Okay, our next question comes from Melinda from Norman.
Hi, how are you?
I'm fine. Thank you for having these. I really appreciate them.
Absolutely.
I needed to ask about the individual. My sister's a realtor, and she's considered an essential personnel, and a lot of her deals have fallen through because her clientele have lost their income. So can she apply for unemployment but still be occasionally showing a house? I don't know how that works, but her broker's requiring her to work. But
that's I don't know on that specific case if you're being required to work, whether you can apply for unemployment. She's obviously eligible for the $1,200 payment, but that's one where I think probably the unemployment folks would have the final decision. That's an interesting kind of in between the case. I think if she were laid off, there wouldn't be any question that she would be eligible for the unemployment payment. But if she's continuing to work, I'm just really not sure.
Next question comes from Selmer.
Hey, Selmer, how are you?
Hello.
Hi.
Yes, Summer.
Hi. Thanks again for having this. This is very informative, and I appreciate it very much. My question was, I am a mother to young children, and with everyone sheltering in place and things of that sort, a lot of people are being able to stay home with their kids, but I am not. In regards to that, though, they have lost a lot of the children who normally come to the daycare. So it's pretty imminent that my children they'll end up having to probably shut down the daycare or at least her classroom because they don't have the money to pay the teacher without the children. I've also been cut some hours at work. I'm actually kind of doing makeshift jobs just to make up my hours. But if I have no daycare, then I don't have anywhere else to take my children. So in that case, would I be able to draw unemployment?
I think while you're working, probably not, but I'm not certain of that. Again, a lot of this, they're literally writing the regs for. This is new. We've expanded unemployment in ways that we've never done it before. You've never been able to be let's say a sole business owner or, self-employed and get unemployment. You can now. Again, the best thing on something like that is to check with our office. We'll try and get you an answer for that. Certainly you're eligible for the $1,200 payment, and certainly you're eligible, since you have children at home, for $500 per child. So there's certainly going to be some help there, but whether or not unemployment would be part of that, really, I'm not in a position to say.
Okay, we'll go ahead and move on to our next question. This one comes from Jerry from Norman.
Hi, Jerry. How are you?
Hi, Congressman Cole. How are you, sir?
Good, thank you.
What's your question, Jerry?
Oh, yes. The President and the Speaker have been talking about a fourth stimulus. I believe it would be the fourth. Some sort of an infrastructure bill. Are we going to be looking at kind of slow tracking that until we get a feel for how this $2.2 trillion bill is implemented?
I think you're right. I mean, we're certainly not doing anything before Easter, or I think this would be on into May or June. Now, I will tell you, what's called the Transportation Authorization Bill runs out in September of this year anyway. That is the money we spend on highways. So there's going to be infrastructure this year, but the President and the Speaker are talking about something dramatically bigger. Again, I think that's certainly something that's on the table that will be looked at. But right now, the effort is to make sure that all of this, which is a massive bill, passed less than a week ago now, that it's implemented, that these checks get out to people, that people that are, unemployed, have an opportunity to get that unemployment compensation that were put there. The business people that are trying to keep their workforce together in this very difficult time have an opportunity to get what's quote-unquote a loan, but is meant to be a grant. I mean, you keep those people working, we're going to forgive that loan. So I think the focus right now is there, but there's certainly already discussions going on, and I have no doubt infrastructure will be part of it. The President makes this point repeatedly, and I think he's right. This is the lowest interest rate environment you're probably ever going to see. Capital expenditures is actually something that everybody borrows money for simply because the lifetime of the project you build is multiple years, so there's plenty of time to pay it back, and you've got something for it. It doesn't just disappear. So I think, again, I'm not sure what the parameters of the package would be or how big, but I would expect something to come, but a little bit later in the summer, not imminently, not this month.
All right. Before I go to our next question, I just wanted to follow up on the question before, the question we just had before this last one. One of my colleagues actually emailed me about child leave, and under the Families Coronavirus Response Act, Families First Coronavirus Response Act, if you have to leave work to take care of your child, you actually qualify for paid leave. So, but you can call our office to get more information about that.
This is the good thing about having staff that's smarter than you are. So, but please use them because they do a good job.
And a lot of this legislation, there's so much in it that, it's just having to, learn how it's all going to work. So, but the next question comes from Tony from Ardmore.
Hey, Tony, how are you? Hello, Tony?
Are you there, Tony? Guess not. We will try another question. We'll go to Michael from Oklahoma City.
Hey, Michael, how are you?
Hello?
Hello, Michael. Hi.
Hi, Congressman Cole. How are you?
I'm doing great, thank you. I hope you're doing well.
Yeah, we're doing very good. I mean, Vicki and I are doing great. She's at home, and I'm a Tinker employee, and I'm still working. I'm an essential, so still doing that. My biggest question was, you're welcome. My question was, if this initial stimulus doesn't really do the effect that you think it's going to do, and this is going to be longer, are you all already working in advance to prepare for anything that might be needed to be done, say, in a month or 6 weeks from now, rather than waiting until it becomes that issue, then having to go through all of the turmoil of negotiations between the House and Senate and the White House? Are you all trying to anticipate another need for this and starting to work on it?
We are. There's a number of things. For instance, some of these programs are brand new, and there'll be an effort to see, make sure they work. But, for instance, let's take the small business loan portion. We could easily run out of money on that. I have no doubt that money would then be replenished. I mean, certainly the Secretary of the Treasury, who's in charge of the economic part of this, has made it clear if there's some place that we're running out of money, we're going to come back to Congress and ask for money for these programs, and that's going to occur. I think, again, we'll be looking in a program this vast, put together this quickly. I don't have any doubt that there's going to be glitches and mistakes and things that we didn't get right, so there'll be an effort to fix that. But bottom line is this. We've had 3 really substantial bills in a row passed with very little partisan dissent. Now, that doesn't mean there wasn't disagreements. It doesn't mean there wasn't hard negotiation. There was. But at the end of the day, again, these are 3 bills in less than 12 weeks, really in less than a month. So Congress is moving much more rapidly than it normally would, simply because they know the scope of this crisis is great, and they've actually worked together well. Look, it's no mystery to anybody on this phone that maybe the president and the speaker don't have the best relationship, but the reality is 3 bills have been passed and the president signed them all, and they've all been in on the negotiation. So I think we don't think that we're done here. We just want to give this time to see how it works, to make sure that whatever we do next, builds on what we've done or fixes any places that we've made mistake, that we just don't keep going willy-nilly forward without having a really clear idea of what we need. But there are discussions underway. I talk to members every day. The committees are still talking. We'll have a conference call of everybody on the Republican side of the aisle tomorrow. We had an all-conference call, that is everybody in Congress, on Friday of last week. There'll probably be another one this week. So, again, there's a lot of work going on, and it's been surprisingly cooperative. So I can't tell you you're ever going to take the politics out of politics, but I've been pretty proud that legislation of this size and scope has passed with very little partisan dissent. And now you always got to watch. Each side will try to get some things into the bills that maybe aren't related to the bills and aren't related to coronavirus and getting the economy going. And that you can't do that. I mean, these ideas may be good or bad in and of themselves, but they can't be riding on a bill that is meant to help deal with this crisis. We need to keep it down to the essentials. That way you can keep both sides on the same wavelength, so to speak, and you can produce this legislation without partisan acrimony and get it moving through the process. And there's no other way to move this other than to cooperate. And we have a Democratic House and a Republican Senate and a Republican President, and any one of them can block the other. And in the Senate, either party can block the other, because you got to get to 60 votes, and there's only 52 Republicans, so they can't do it. Obviously, the Democrats can't do it. So this puts a premium on cooperation and interchanges back and forth. But I've seen a lot of areas of cooperation. For instance, I was just on a letter that was almost evenly balanced between Democrats and Republicans for additional help to rural hospitals. We've got a lot of them in this district. So again, there's a lot of areas that individual members are focused on and seeing, okay, a problem's developing here. Who else, has a similar interest or, similar concern? I don't care what party they are. So we've actually worked together, which amazes me, coming off of an impeachment that was very divisive and going into a presidential election year that will be awfully, contentious between the two parties. And yet people have been able to put it aside so far and say, we need to get big things done. We need to get them done now. We need to make sure that we get the American people through this with as little damage and as little loss of life as we can. And people even of very different views agree on that objective, and so far have been able to find ways to work together. So hopefully we'll continue to do that going forward.
All right. I think we have time for just one more question. This hour has really flown by. But our last, maybe potentially our last question, we'll see how long the question answer takes. But
it's never the question, it's the answer. Brady, just Tom, how are you?
Hi, Congressman. I'm Brady Dern from Ada, and I'm a small business owner, here in southeastern Oklahoma, and I'm so pleased by the response that we've seen, from our representatives, to come to the affected, businesses and individuals, because we're all affected by this. But my question is a little bit bigger. We're really expanding our national debt. I think everybody on the call, I think somebody got something. What are the long-term implications that come from this level of federal spending, and is it sustainable?
No, it's not sustainable. This is an emergency situation, so no, we couldn't do this. And frankly, in my view, we were on an unsustainable course anyway. Now, you have to figure out, okay, what's causing your long-term debt? And I don't want anybody to get rattled by this, because I'm not talking about changing the Social Security or Medicare or Medicaid system, but you have to change how you finance them, because those three programs are 60% of all federal spending. You can look at what we do on the military and overseas military operations and compare 2010 to 2019, the last year we have complete figures for. There's almost no change. It's basically flat funded. Actually, it's a little bit lower in 2019 because 2010 we were much more heavily engaged in Iraq and Afghanistan. Same thing on the non-defense side. That is things like the National Institute of Health, Center for Disease Control, things we've been talking about here. We were spending about the same amount of money on all those things collectively in 2010 that we were in 2019. The big increase was the increase in what's called mandatory spending. Again, that's Social Security, Medicare, and Medicaid. That was about about 1.9 trillion in 2010. It was about 3.2 trillion in 2019. And the reason is simple. We have the largest generation in American history of the baby boomers, and they're now retiring, and there's 10,000 people turn 65 every day for the next 19 years. Those people are immediately eligible for Medicare. They're either already on Social Security or soon will be. And so, again, we're not going to cut those payments, but you're going to have to look at what you're going to do. Does Warren Buffett need a Social Security check or a Medicare? I'm not suggesting he takes it. I have no idea if he does or not. But, whereas we know people that's all they've got, they definitely need that. So we'll never cut it for people that are on it or anywhere close to it because we've paid into it. But, we made some adjustments to save Social Security back in '83, and actually, if you were my age, you couldn't get a full check until you were 66. If you were my son's age, 67. So we made some changes, and we're going to have a give and take dialogue like that again. And we also, by the way, increased the amount of income that was subject to Social Security taxes. You may have to do something like that again. But until you get those programs solvent, there's no way to cut it. But it's politically difficult because everybody acts like you're trying to get rid of the programs. We're not. They're very popular programs. But bottom line, you're exactly right. Long term, this is not sustainable, and we're going to have to get serious about submitting budgets that can be brought into balance over time.
All right. We are near the end of our telephone town hall. I'm sorry we weren't able to get to all of your questions, but you'll have the opportunity to leave a message and receive a call back from our office after Congressman Cole provides some final words. Congressman?
Well, thank you very much, Sarah. And I want to thank all of you that took the time to listen to this. I appreciate it very, very much. It's very helpful to get your questions and your feedback. And if we weren't able to answer the questions, please follow up with a call to the office. We'll be working to try and match people to help them get the benefits that they are entitled to under this legislation, certainly to answer your questions or get you hooked up to the right agency. And the question obviously doesn't just have to be about coronavirus. We know the world goes on, so there's always Social Security issues, veterans issues, immigration issues, and the like. And, we have people here that are very, very good at dealing with those, and we certainly want to try and help you in any way that we can. And we want to get your opinions. It's extremely helpful when you call in and tell us what you think and what you think we ought to be doing or what your individual experience is. The last two things I would ask you to do is first think of your friends and neighbors. If you're fortunate enough to have a steady paycheck, I hope you're able to still give to that worthy local cause or that charity. They're going to be under a lot of strain, and I hope you are able to look in on your friends and neighbors, and particularly if you've got senior citizens close by, just check on them, see how they're doing, and you might be able to get them a meal or go out and shop for them and get them that thing that they really need, but they don't need to be out in the community doing, because they're more exposed or more at risk. And same thing, if you see a single parent that's got kids and struggling a little bit, see what you can do to help. The last thing is, please keep your confidence in our country and our institutions. Look, we're Americans. We're awfully good at coming together in a crisis, and certainly Oklahomans, I think, are the cream of the crop. We've seen that after every tornado or the Oklahoma City bombing or you name it. Oklahomans are good friends and neighbors. They pull together. They don't pull apart. And honestly, I think that's true of our fellow Americans as well. So we'll get through this, I guarantee you, and we'll be successful and we'll come back stronger. But in the interim, we need to all work together, and please listen to the requests and the advice and the instructions you're getting from federal and state and local officials, and try to help them out. They've got a really tough job, and everything they tell you is they're just simply trying to protect you and your family, make sure that we slow this thing down and we don't overwhelm our hospitals and our healthcare system. So if you can do that, we'll get through it that much quicker and come out of it that much stronger. But again, good luck. Don't hesitate to call us, and God bless you, God bless your families, and God bless our country.